Dayne, thanks for being with us. This was a lot of work. It's a big story. How did you collect up all the data?
I spent a lot of time from January is when I started, and I collected data nearly every day from Indigenous Services Canada website, where they post the COVID-19 numbers for Indigenous communities across Canada, but each provincially. So I picked them up whenever they post them, which was most days of the week, and compiled them, and then compared them with the registered populations that are posted from the government as well, to see kind of what the infection rates were per 100,000 in these communities.
Did you have to look around aside from Indigenous Services Canada? I've noticed their website isn't always up to date.
Yeah, so it wasn't, like you said, it wasn't always up to date. There were some days where they wouldn't post, some days they would post twice. But that was kind of the main central spot where the numbers were posted most often. They did have, in Manitoba, the First Nations Health and Social Secretariat of Manitoba posted numbers on there, which were super helpful to gathering all this data. But they were specific only to Manitoba. So for places like Saskatchewan and Alberta, it was a little tougher to gather those numbers, so I had to depend on Indigenous Services Canada.
Yes, I would commend Manitoba First Nations for the job they've done here. What did your project tell you about the situation in Western Canada?
So like I said, I started in January, but I was actually curious in December. So when I looked in December, I did some quick calculations, and I immediately noticed that the case numbers for the population per capita were much higher in First Nation communities. So I looked at those numbers over the long term, and that's exactly what the numbers said, is that per 100,000 people, so per the population, the case rates for COVID-19 were much higher in First Nation communities on reserves. But also within the city, in the article that I wrote in Winnipeg, rather, they have the COVID-19 rates posted, as well as the population for Indigenous people in the city. And so it said that in general, the kind of ratio between COVID-19 and Indigenous people was higher than the general population.
Well, Dayne, we'll have to leave it there, but I would encourage everybody to go over to our website, check out the story. It's a massive story with a lot of work into it. Thanks for being with us here today to speak about it.
Thanks, Dennis.